Yeah. You're gonna let me do something.
Too. This is Dr. Cruz waiting on Dr. Ornedo
Right.
for him to call his wife. He's in trouble with his wife right now. Yep.
What's the name of it? Zyrtec generic?
Cetrizine.
How do you spell it?
Cetrizine. I tend to spell things very fast, and people like don't get
I got it.
they get agitated with it, you know. AGITATD.
You're
Yeah.
probably like the biggest, fastest. You're probably on the spelling team or one of those things.
I lost, but that's okay.
You haven't forgotten it.
We're still waiting on Dr. Ornedo to type cetrizine.
In Claritin, generic.
Do.
Are you serious? We're still on?
Yeah, you're on.
I'm sorry.
We're on live, actually. No, I'm just playing.
I'm gonna be watching it. What?
You're like, what the hell?
I can't even.
All right, let's start. Hey, this is Dr. David Cruz,
And this is Dr. Carlos Ornedo.
and today we're going to talk about other things. No, we're going to talk about a couple of minerals and type of things that you can buy over the counter.
Why don't you tell me what your patients or your experience?
Mm-hmm.
How about alpha lipoic acid?
And that's a very good medication.
Okay.
Alpha lipoic acid. I usually give it out at 100 milligrams twice a day.
Okay.
And I combine it with B12. So alpha lipoic acid, especially for diabetics.
That's what I was about to ask you.
Diabetics, man, it helps the nerve pain to the legs. You know, diabetics have this burning sensation to the feet. Their legs hurt a lot.
They want to put something on it.
Yeah, they've tried gabapentin, but that makes them sleepy, or they try something else and that doesn't work.
Swollen.
Yeah, so I've had some patients that I put on alpha lipoic acid and B12, and their pain goes away, and they feel like they can walk now, and they feel dramatically different, and it really alleviates the pain. So before I go to anything strong. I always use that first. I use alpha lipoic acid and B12. Great medication. This one particular couple, I saw them back within a month, and they were like, "Man, now I'm walking," and things like that. So it makes a big difference.
I had not used the 100. That's good to know. I know there's like a 2, 3, and I think a 6. But I think knowing that 100 twice a day, it's a
100 twice a day, it works very good.
What's the dosage on the B12 for you?
B12, I usually give 2,500 to 5,000 micrograms.
Okay, that's more than I have used. Okay.
Yeah, that's about the dose I like, because that really does help a lot. I mean, both of those medications, alpha lipoic acid is also going to help the brain. It's going to help all this other stuff.
Yeah.
And then B12 helps the nerves a lot as well, and blood production, and your brain, and everything. So it's good to have. Plus,
it's amazing how these things help.
Yeah. Plus they're water soluble, so a lot of it's going to leave your body right away. So you have to make sure you take a good dose. You need a good dose. What about magnesium? Do you ever use magnesium?
You know what? Magnesium is a great mineral too for multiple things, like you're mentioning. One of them that I know that it's the contractibility of the heart apparently is very helpful. Magnesium is used. But simpler for our practices, I think for headaches, I've used it a lot.
Yeah.
Combined, with Dolbutal or whatever it is that they need for a headache, whether it's muscle tension or a migraine. So I personally have tried that.
Yeah, it's good. And I use it a lot for muscle cramps also.
That's right.
Muscle cramps. I mean, patients tend to get more relaxation. Yes. The magnesium oxide, 400 milligrams is usually what I use.
I was about to ask you. It's usually 400.
400, and I use that once a day at bedtime. I get to them at bedtime just to kind of help. Relax the muscles a little bit, and they feel better.
That's usually when they get the cramps.
Yeah, right? A lot of nighttime cramps, definitely.
Diabetics get so many. Is that where you've seen it work?
Yes. Okay. Yes, definitely. Now, we have getting into some medications that are prescribed.
Yeah.
We've seen Xarelto, which is we use all these other anticoagulants now, right?
Yes.
Now Xarelto is the one that we use for atrial fibrillation or things like that to keep the blood thin. But where I've seen it have a great effect is on people that have ischemic toes, and now using it in combination with aspirin. Now sometimes you can use it with, I've used it with Plavix, but it's now they make it with aspirin so that you can actually get better circulation to your toes and help that circulation maybe save a limb or a toe or something. Makes a huge difference. And until you can get them into, the vascular surgeons to hopefully clear out some arteries or do a bypass or something else. But in the meantime,
helping them clear that and maybe not have to go through that.
You would hope that they don't have to. And it usually does a pretty good job as far as helping get things better.
Yeah, and for diabetics more than anything else. I was going to tell you, I had a patient last week who came in with a big swollen calf and a lot of tenderness, right? He was a young guy, like 50-ish, no risk factors. Maybe there's a family history of, some type of blood disorder, but he really didn't know. He just knew that he was the best in shape. He suffered only from maybe high blood pressure. But he was an active guy, working out, running. But he drives, so he's always in car sitting position and so forth, right? So anyway, we ended up having to do an ultrasound on him, found a clot. So these patients, I remember in the past, we used to admit them.
Yeah.
Even asymptomatic. Oh no, put him in because...
Put him in the hospital, yeah.
Now the criteria is different. Is no symptoms. You obviously follow him closely. You give him Lovenox. Go home and inject yourself with a little bit of a, thinner for like 3 days, 5 days. And then you mentioned Xarelto. That's the big one. You can use Xarelto.
Yeah. So now what we're doing most of the DVTs, all these deep vein thrombosis, is just start Xarelto off and don't even admit and just treat it.
Amazing,
it's nice, man.
It's really nice.
Saves money.
Saves money there.
Saves money, man.
Money you remember, was it Coumadin?
Yeah.
Okay, no, he's got to go to the Coumadin clinic down the hallway and get his blood drawn.
Yeah, it's like...
And he comes there to watch you and it's all bruised.
Yeah, so now...
I think I'm not even...
For all the patients, that's the good thing about these medications now, that you don't have to get your blood drawn. It's just an anticoagulant. It works great, and you don't need the needle sticks to be checking anything at all.
It's wonderful.
Yeah.
It's a wonderful thing.
Good stuff. But there's also precautions with them because you don't want to fall and start bleeding, because you can bleed easily as well into the brain or anywhere else. So there's always precautions with these medications that you have to take. And especially you have to mention that here on the border, because Mexico is right there, and people tend to go buy medications and start taking things because their vecino told them that it was the right thing to take, and it's like, dude, you can't do that.
One day, I went to the urologist over there because I didn't want to have to wait. I go, but what happened? Well, he told me I had like a little rock and I had something else going on. I'm not even sure, he said. I'm going, well, that's the point. I can't check it for you. And do you have the papers? So he's going to go home and bring me all this stuff. It's not about the docs. It's just about we're so used to how strict, the U.S. is with health.
Yeah.
And that they know that too. The patients know that. So come back like that. It's really interesting.
That's very true.
I wanted to tell you about another mineral, but sort of something I've been using. The gut. I mean, everything seems to be in the gut. And I think we talked about stuff like this. But if you get blood tests, or sometimes we get markers, like CRP, these markers. One good medicine or supplement is your fish oil.
Yeah.
And of course, being brain food as well, it helps the heart and helps also bring down inflammation, because that's literally what happens with our gut. Our gut is our first brain.
Yeah.
So everything comes here is going to affect the brain. If you control this will be less. So it's fun stuff. Exciting talking about different things.
Yeah, that's pretty good. And they have now that medication Vascepa.
Yes.
Very
They did a study,
purified,
right?
very purified omega-3, and it's
What
actually.
does it actually mean? Very purified.
Well, it means that it's very purified.
It's just very clear looking.
It's very clear. Well,
You must
they.
have stock in it.
No, I don't, man. But it's the studies show that it has been very, very beneficial as far as decreasing heart attacks as well. In addition, right?
Yeah,
So, and I think that's
absolutely.
what the studies were showing. I think
Well, anything else besides the triglycerides?
yeah, and the triglycerides come down, chances of you getting heart attacks less, all that type of stuff.
Nothing's gonna be able to replace like a statin.
Oh no, this is in combination, and this is above and beyond with the combination of all the other medications that you already take.
Yeah.
And so that's actually pretty good. I mean, that's a good, and that's omega-3, that's fish oil, that's all that type of stuff that's you're going on. So a lot of times those medications are really expensive to buy. So you go back to your fish oils or your omega-3s, 4,000 milligrams a day, right? So decrease your triglycerides, that really helps. And it does help the gut.
Big time.
So
inflammation is like all we are. I mean, it's literally people. If we remember, we talked about one time we were mentioning whatever problem we have or health problem, we always talk about you eat better, you sleep better, you exercise. It really is the core, the foundation of everything.
Yeah.
You decrease all these, problems.
Yeah, you do decrease all the problems, and inflammation is the biggest thing. And we talked about food being the inflammation thing, what you're around. If you're around
like
smoke,
those here and there. We see our patients that come in and say, so I can't leave those little,
Can't leave them. Sorry, can't leave them. Not
That's
going to do
off. We can talk about everything else, but those little panecitos.
Yeah.
Go ahead and eat those.
There you go. You gotta start slow. Man. Baby steps. It was pretty fun, man. I think that it's always good to talk about different things and different remedies that the patients can use because there's so much out there.
We talked about one earlier. Remember diabetes?
Which one are we talking about?
Getting to try the supplements.
Like chromium picolinate and the cinnamon.
Cinnamon.
Yeah.
Exactly.
Yeah.
And many patients, they were getting really smart about stuff like that because here's the problem. There are problems with a lot of the pharmaceuticals.
Yeah.
I guess from metformin to others.
Well, I've come to believe a lot of I love the medications for diabetes, and they do wonders. I mean, they do wonders, and the drugs that your doctor are giving you, they're good medications, man.
They really are.
They're amazing, and they do great things for your diabetes and your system and trying to take care of you. But there's nothing better than just a good diet, man. You take care of you take care of yourself.
Yeah. Talk about where are the vitamins? What are you eating?
Yeah, exactly. It's all there, and so the weight comes off, the diabetes gets better, the blood pressure goes down, your cholesterol gets better, everything gets better, and that's the medication that we need to push.
That's exactly.
We need to push the diet, we need to push exercise, and exercise not so much. I mean, I tell patients, you don't have to exercise, just start doing something, a little something, but do something, but just to keep active. But as you lose weight, you're going to get more active.
You get more energy.
You get more energy,
that's
man.
The whole point,
Yeah.
Try to
but that's
balance the whole deal there.
And there's a lot of patients we can take off of medications. If
Maybe
they just
we
try.
never used to say that, I guess, because we were just taught we
Yeah.
take it forever.
Yeah, you're gonna be taking this forever,
It's
but
not true.
but we start seeing these surgeries, these lap band surgeries make a difference in people's lives.
Oh, yeah.
But it's not the surgery; it's the weight
It's
loss.
a weight loss, literally.
Yeah. So how do you train yourself to do better?
Absolutely.
So that's important. How do you train yourself to get better?
Try it out.
All right, man. This is Dr. Cruz.
Dr. Romero.
We'll see you next time. Take care.
Take care, guys.
I wasn't recording. No, I'm just playing.